Good afternoon, everyone, and welcome back to those who have joined us previously. And for anyone who's new here, my name is Kira Griffin, and I'll be the host for today's session. So I think this is our fourth or fifth session in our webinar series this year, and we discussed a range of topics from where to start with implementing AI. We showed practical demos of what AI workflows could look like, but I suppose the main question that came from people who registered and our clients was what's appropriate in a regulated environment and how do you remain in compliance when implementing AI. So I think we thought of no better guest speaker to have on today, but a notified body. So very excited for this conversation today. So our speakers today, we have our two reliables. We have Connor Flynn, our Head of Innovation, and Colm O'Rourke, one of our quality and regulatory consultants here at Trinzo. And we also have a new guest speaker who is Steven Byrne, as I mentioned, from Scarlet. He is a software developer specialized in safety critical systems. He has successfully delivered software as a medical device, software in a medical device, and AI as a medical device products throughout his career. So now with Scarlet, he provides regulatory guidance to manufacturers of AI and software medical devices, helping them navigate the complexities of compliance. So welcome, Stephen. So our agenda today will kick off by framing the conversation of why we're here today and why this conversation matters. We'll then have a live demonstration from Scarlet on how they support their clients who are interested in using AI. And then we also have a Q&A, which is informed by your questions you've added in when you registered and kind of questions we've collected throughout this series. So we will be just going through them. But if any particular questions pop up as we go through the session, just pop them into the Q&A box or the chat and we'll address them live also. So we'll be hoping to wrap up in at 2:45 if you're in Ireland here. So yeah, with that, I'll pass it over to you, Colm. Connor, sorry.
I think it's Connor, isn't it?
Yeah, I think it's me first.
Great start, Kira. Thanks.
So obviously we've been working with a lot of different companies here in Ireland, and everybody's asking, what can we do today without causing problems later down the track? And a lot of people are seeing opportunity for what they can do, but they're worried about what the knock-on effects of that is, particularly in a regulated environment. So I'm delighted to have Steve here today to help us with that. I think, like I was saying about this slide beforehand, and like I was saying, how do I not just read it? Because like everything there, I don't think anything is particularly controversial or challenging. Like we can all see the AI adoption accelerating. We can see people adopting tools, abandoning tools, going all over the place trying to figure out what's the best way to do this. But we can see that when companies block their employees from accessing AI tools, a lot of the employees just use it at home. You have the shadow AI problem that Kira talked about a couple of episodes ago. Am I allowed to call them episodes?
Whatever you want.
Sure.
Okay, cool. And we can see that from the work the FDA is doing, we can see that expectations are evolving. Actually, Kira and I had a call earlier on today with Enterprise Ireland. This is a little bit of an aside, but clearly the scope from them in investing in R&D has changed, whereby they were signaling how flexible that they were looking to be when investing going forward. And I expect that we're all trying to figure out at the moment what is acceptable at the moment as the technology changes very quickly. And this balance is a real tough balance to figure out what the right thing to do is. So if you move to the next slide there, Kira. Just a quick reminder, traditional software, deterministic, you're able to validate it because it does exactly what it says on the tin. But this new generative AI, when part of or the complete the complete solution that you're looking at will create probabilistic outputs. And we've talked about that before. It's very variable, and it's difficult to validate, certainly as a standalone. That's why we keep talking about human in the loop. But I think our understanding of what human in the loop means is evolving as well. So we've seen, like in the news recently, the Meta employees who are, let's just say, unsettled because they found that now that AI has been implemented, their jobs have become, am I allowed to say, crap jobs? Whereby they were highly educated, high flyers, lots of experience, really good at their job. And now all they're doing is reviewing AI output. We need to be careful when we are designing solutions for problems that we're looking to solve in quality or regulatory systems, that we're not destroying the job of the human, that we're not destroying our pipeline of the next set of people who are going to make decisions for our company going forward. We're making sure that we highlight that AI is used to amplify the skills that we already have, rather than find the most efficient path to get something done. And this is something that we need to think about individually within our teams and within our companies. And you need to start looking and seeing what's happening out there and understanding what's best for you. I didn't say anything controversial there, Kira, did I? Oh,
we'll see. Thanks, Connor. So I'll take this one, and this is it's a little bit of scene setting, I suppose, and a bit of a recap, because we have talked a fair bit about risk assessing use cases or AI tools, right? So what the graphic we have on the screen here, this is just something we've come up with at Trinzo. So there's no there's no standard out there right now. There's no guidance even from regulators right now on how a manufacturer can risk assess AI that's being used within their quality system. And I guess why we need to risk assess it, and we'll certainly talk a good bit about this later with Steven, but it's the level of testing, right? We're careful not to use the word validation, because we can't validate in a traditional sense, AI tools. But the level of testing that we need to put into an AI tool, and the level of control, then the level of human oversight, it's dependent on risk assessing, right? And anyone here that's dialing in from the device industry or life science in general, like, risk assessing is everything, right? It's anything happens, let's risk assess it, right? That's the first thing people consider. And it's built into 13485 with a risk-based approach. So I guess what we're showing here on the left-hand side is there's kind of two elements that we propose companies could consider when risk assessing AI tools. On the left-hand side is, what are we actually asking the AI tool to do for us, right? Are they just summarizing a document, which would be low, or are they perhaps analyzing information, which might be a little bit higher? And then the highest one is they're making decisions or recommendations. So that's what we're asking the AI tool or agent to do. And then across the top, it's, what do we actually do with that information? So like any process, and again, in the life science industry, we're very, very familiar with the process approach. We have an input, we have an action, we have an output. So what do we do with the output of that AI information? Is it purely for internal use because we're summarizing emails in preparation for a meeting? That's going to be pretty low risk. Medium, so maybe it's within our quality system, and it is supporting some decision making. Maybe we're using it from an internal audit perspective to support internal audits or management review. And then high risk output would be, we're using the output to support a regulatory submission, for example. So like, if we're using AI to analyze papers as part of literature search, that would be certainly high risk. And then what do we do with that information? We build it into the control system, right? The guardrails that we put around this AI tool within the process. So the level of human oversight or the level of testing that's involved. So and I'm sure Steven will touch on this, and in the questions, we're going to come back to it as well. But we just wanted to, I guess, get everyone thinking on the same page, that when we deploy an AI tool within a process in our quality system, we have to consider we have to risk assess that just like we would anything else.
Yeah.
Oh, sorry. Yeah, and I think with that, I'll pass it over to you, Stephen, so to share your screen and do the demo.
Perfect. Thanks very much. Yeah, just to frame the demo I'm about to give, I would say the most common use of AI we're seeing with manufacturers of medical devices at the moment is like, how can they use AI to help them prep for submission? So, under EU MDR, they've got to provide their quality management documentation and their technical documentation to us as the notified body for assessment. We're definitely seeing a lot of manufacturers want to use AI as a co-pilot. And what they want to really know is, as I'm creating my documents, what does the notified body expect, and what is the level of good enough, and can I use AI to help me answer that question and create documentation or co-pilot in the creation of documentation for the assessment. So what we've done is, if I pull up my screen now, I'll show you our web portal that any of our customers log into and see. You guys can see that okay? Yeah.
Yep.
Perfect. So yeah, this is just an example workspace we have of a fake customer. And if they log into our portal during the pre-submission phase, this is what they would see. And down here, they've got two tools, which I'll go to today in the demo, as how we support customers in their journey in creating their documentation and preparing for a submission. So for this example, I'll hone in specifically on just the instructions for use document. So for instance, here's an example document that a manufacturer may have drafted. It's a very simple instructions for use document, contains at the moment just 6 sections: device information, manufacturer details, stuff on clinical performance, safety information, training qualifications, and operational procedures. So it's quite lightweight, 3 pages. One of the things that our customers will ask is, they'll ask themselves in preparation, is this good enough? Is Scarlet going to accept this? So the first tool that we provide is very much our knowledge base. So if I go into our knowledge base, it provides sort of our guidance and best practices. If I scroll into what to submit EU MDR, general instructions for use, you'll see we've got an article which is on what we expect for an instructions for use document. So what's the minimum things we expect to see in that document? What are the common pitfalls we see? So what are the things that we generally raise queries against during the assessment? A little note on what our preferred format is, and then an ability for the manufacturer to go and deep dive into, see, well, okay, when we say we want to see manufacturer details, what information do we really need? So you might ask yourself, what's got to do with AI? What we see manufacturers want to do is basically copy all of this information out into their own LLM chatbot and be able to compare that to what they've produced. So what we've done is we've provided a very simple button that allows them to do this. So if they press copy prompt, what they can do is then come across into their LLM of choice. So I'll use Claude, for example, and they can just do a Control V, and you'll see that this is the content that's been pasted out. Now, I'd like at this stage to reaffirm that this is not our LLM. It's very much all we're providing here to the manufacturer is a very simple export, textual export from our knowledge base in Markdown format, which is nice for an LLM to read. So we have the context that's in the knowledge base, and then it scroll down at the bottom. There's a prompt to the LLM, which says, look, this is what I want you to do as the LLM. First of all, check if the customer is uploading a template or actual documentation, then evaluate that documentation against the content of the knowledge base and provide an output in this format. So all that the customer has to do then is drag and drop in their draft documentation and press go. And what this will do then, Claude will go ahead and it will actually provide a review of that. So again, this is just a way to help them to use their own LLM of choice as a co-pilot. So while Claude is thinking on that, I'll go back and I'll show you the other tool we have. So if I go back again to the home page, we've got this coverage check tool. And again, this is something that is used in pre-submission by the manufacturer. It's not an assessment, but it's something that helps them build confidence in how good their documentation is. And this is something that is built into our system. So what we do here is, again, the customer drags and drops a file in or multiple files, and then they request coverage. There's a few questions we add in here as well to understand the scope of their device. And now this will go and run for about 5 to 15 minutes, depending on the size of the documentation. But what I can do is I can show you what the output is. I've pre-prepared it over here. So what they'll get is a coverage score across their entire technical documentation. Because we've only uploaded the instruction for use document, it's very much just a point arrow here, not a radar plot. And you can see that if you scroll down here, you'll see instructions for use of the things that we expect. Some of them are covered, some are partially covered, and some is completely missing. So again, it's a directional note to the manufacturer of how good their documentation is and where they may want to increase coverage. You'll also notice as well that there is some like bleeding into other areas, and that's again the way our tool works. It's very much directional and based on the terminology that's used in our knowledge base. So for instance, the intended purpose statement, you kind of expect to see some of the similar information in the instructions for use. So that's why you get kind of bleeding across those. And just to give you an idea, if you upload a quite comprehensive set of documentation, you get this nice radar plot. So again, in this example, this demo customer has uploaded a lot of information related to the post-market surveillance, and it looks quite good, but maybe on software and device information, there's a bit lacking. And you can see they probably haven't uploaded a GSPR checklist. So I'll see if Claude has finished. So yes, Claude has come back with a summary of what's been covered and what's not, and what might be the problems. So again, this is information that the customer can use in their own journey to create their documentation. So they can continue this chatbot conversation. They can maybe take the learnings away and they can go and build a second version. And so, for example, I've got a second version here that has taken on the advice from Claude. It's added in. I should actually be able to open it up. It's added in more sections here on technical information that was missing. It's beefed out some of the safety information. It's beefed out some of the security or the clinical performance information as well. And essentially, it comes out with a score of 98%. So again, it's just we're providing like a roundabout workflow for customers to be able to have a sandbox in which they can operate during pre-submission to try and build their confidence, and to try and help them, facilitate them use LLM if they want to help generate that documentation. With the ultimate goal being is that they'll be able to move faster during that pre-submission phase, be able to fill the gaps they have in their technical documentation and get to an assessment faster. And hopefully if that assessment or that submission is quite complete, we'll have to raise less findings during their assessment, and ultimately the manufacturer will get their certification faster. But yeah, that's the demo.
Can I just interrupt straight away? Sorry,
Yep.
While you still got this on screen here, question fresh. And like so we've seen this before, obviously, because we practice in preparation. But perhaps you can remember the shock when I saw this first. Like it's genuinely blew my mind that you guys have this feature that's available to your customers, and I think it's fantastic. And I assume it's just the way that every notified body is going to have to go, because, like you say, everyone wants to get the best quality product on the market as fast as possible into the patient's hands or into the clinician's hands. And this is a way that a notified body can support that. But I'm curious if you can share what your experience, just totally anecdotally, is on how are your customers actually using the coverage checker? Like, are they interacting with it constantly, or do they dump a file in, they go away for 6 months and come back again? Or like, have you any bit of insight to share how it's used on the ground? Like,
yeah, it really depends on the customer. And I would say some of the more innovative, newer customers are the ones who are adopting this much faster. But what we're seeing, I'd say, is that they are using this quite a lot, but they're not overusing it, especially if they're competent. So we see regulatory professionals who might be consulting for a startup. They're coming in, they're using this. They have a good idea of what their template is in their mind and what needs to go into it. But every notified body is slightly different. And like software as a medical device or AI as a medical device has extra expectations as well. So some of these regulatory professionals may be quite competent, but also have some areas where they're slightly concerned about. And they'll use this 2 or 3 times, get a feel for what's missing from their documentation, and able to go back, take that learnings back to the team, flesh out that documentation over a week or so, and then come back and re-upload it again. And if they do that iteratively for each aspect of the technical documentation, they definitely are moving faster if they're using this tool. I would say the one caveat we see is that we might get people who are, let's say, earlier in the regulatory journey, and they're then using this very much as a crutch. And yes, this will help you in understanding maybe where you're lacking, but it's not ultimately going to be able to tell you exactly what information needs to go in there, because that needs to be specific to your medical device. Yeah. So that's one of the caveats we see is it's way better in the hands of people who know what they're doing and can, you know, leverage their own experience and bring that up, rather than someone who's trying to use this as a crutch to overcome their own regulatory, you know, naivety, I would say.
Isn't that just summarizes the use of AI in general, I think, doesn't it?
Yeah.
Yeah, that's brilliant. And like, you guys don't, Scarlet doesn't use as in, I suppose, just from the point of view, like, you might have some manufacturers dialing in now thinking like, no way am I putting my half-baked documentation in there so that the notified body is going to see it. But like, you guys, you don't interact with this information until the point that it actually gets submitted, do you?
Yeah, and that's a really good point, because that's something that when, especially we get more established, bigger companies who's come in and they have a lot of concerns about, you know, sharing information, that this is very much your sandbox. No one sees this. It's uploaded into the system. The semantic search algorithm runs on it, produces a report, but we don't retain the documentation. We don't look at it. So yeah, we have to try and tell our customers when we first introduce these tools that, look, this is a safe space for you to play in. You know, it's just their representative for you. It's not something we're going to assess or critique.
Yeah, very good.
Just another question there, Stephen. Have you had many of your clients kind of question the reliability or accuracy of these tools? So with the prompt or with the coverage checker?
Yeah, it's a good question. Again, I think we've had a small number of people who think they maybe get overly confident, I would say, or they realize they can game the system. So for instance, one of the, I'll give you a very quick example of within our prompt, we actually had to improve this, because when you have templated information, if you just put a template into this, our semantic search might come back and say, oh, you seem to have covered a lot of things.
Yeah,
but it's just the headers. Yeah. So we've had to improve our algorithm a bit to make sure that this system is not gamed, and it's not, you know, misused. But again, we have a lot of disclaimers around this, and it's a tool to help manufacturers, but it's not part of the assessment process. And we're very clear on that, you know, it's just there to help you, but don't over rely on this. You know, it doesn't replace your own competence.
Very good. So I might move into some of the questions Kira mentioned. So thank you to anyone that's listening who provided questions in advance. It's really, really helpful for us. So I think maybe one of the areas to start, and there was several questions, but it really kind of comes back to this common theme, and that is maybe a bit of fear and expectations, right? So it's, you know, a manufacturer that's using AI tools within their quality system, and they've got a notified body audit coming up, and it's the expectations, right? So like, and I know I'm not going to ask you, Stephen, and you can't tell me, well, what do we have to do to prepare for that? But I suppose, can you outline what your expectations, Scarlet's expectations might be around, like, if you see a manufacturer using, you know, an LLM to help with root cause analysis in a CAPA, or to help maybe with trending in complaints, or whatever, I mean, any use case, like, do you have sort of expectations in terms of the level of documentation and testing and the human oversight we've talked about? Like, what you know, what information can you give us that might help manufacturers feel a little bit more easy about implementing such tools?
Yeah, and I just before I even answer that, like, I think that worry is the thing that we're seeing a lot. Every time we attend a conference or some sort of regulatory event, there's a lot of people are worried that, well, I'm not going to use AI because actually the amount of burden I'm going to have to put on my QMS just to show and rationalize why it's safe to use it is going to negate any sort of benefit I get. And that's one of the reasons we're talking on this topic, is that we want to put out a message that, yes, we expect you to do certain things, but it shouldn't be you shouldn't be overwhelmed or you shouldn't be shying away from this. So yeah, if I start at the very sort of, the way I look at it is what we expect is like a tiered structure. If I start at the bottom, the foundation level of that is first be transparent that you are using it. So we don't want people using, the shadow API or AI and just not saying in their QMS. So be upfront and say, yes, we use AI. Then look at, well, what tools do you use? Define the tools that you have approved for use and do proper supplier management around that. So if you're using, OpenAI or Google or Anthropic's AIs, have supplier managed record for each of those. The next thing is competence in training. Make sure that you have records to show that your people are competent and trained on how to use these tools, because this is going to be really important when you come to rely on human oversight as a risk control. And then beyond that, it's very much, okay, well, what's the intended use for all of these? So think about then the specific uses that you're using AI for, and then for each one of those, as you've put on your slide before, take that risk-based approach. So when we look at the risk matrix, we sort of look at it in a few different variables. First of all, what could go wrong if you miss something in that use? So if you are using AI to, let's say, filter and screen all of your incident reports coming from the market for your medical device, and it misses something, that's a critical incident that needs to be reportable. It's putting your compliance at risk. It's also putting your patient safety at risk. So, you need to look at what's the severity of that. But the other thing we look at is how you're deploying AI. So you can have AI used, like as we look at it, as a co-pilot and a chatbot. And if that's been used by a competent person and the kind of oversight is inherently baked into that process, there's lower risk of you missing something in. Whereas if, in contrast to that, if you're using, let's say, an agentic workflow where you're firing data through an API and it's generating some output, that's an automated system that doesn't have a human in the loop by default. And you then have to define, well, how do I put a human in the loop or on the loop to review that output and make sure it is correct? So they're the kind of things we would look at from the level up. And then once you get to that definition of the risk, is this high risk, medium, low risk? Then you look at, well, a combination of ongoing upfront testing, ongoing testing, and human oversight to show that you're controlling that risk effectively.
Yeah. Okay. There's a lot in that. Yeah. I mean, I have a couple of follow-up points, but Conor, I don't know if anything you want to come in with there, or comments or other questions on what Stephen is saying.
No, I suppose I was thinking as Stephen was talking there, like your intended use, are you writing it down to say, I'm using this to assist the human in order to generate this document? Like, that's surely lower risk. Well, it depends on the document, I presume. And automate, like you'd be automating sending emails. You wouldn't be automating anything that had any risk attached to it. And then augmenting, again, it's all about what the job of the human is. How do we ensure that the human has the right information at the right time, is properly trained, knows what they're doing, understands the limitations of the tool that's passing them the next piece of information or giving them information or that they're using. Yeah. Sorry, I'm just babbling now. Yeah.
That's all right. I was about to cut you off there. It's fine. So one topic, and I think this kind of came through in some of the questions beforehand, and I see we've got some questions coming in the chat, which is great. So please keep them coming. It was around kind of change management, right? And changes within, perhaps within the AI tool itself or within the model, right? And there's the term model drift. I won't pretend like I actually understand what that means, but that, like, how, I suppose, what can a manufacturer do? Does it come back purely to the human and then it comes back maybe to the training? But like, if you test something now in 6 or 12 months, how do you know the output is still, as it has the same quality as what it might have been 6 or 12 months ago? Like, is there any insight on that?
It's something that is inherently different from the classic software and AI. Like in classics, software validation you would do for any kind of QMS software is you were always in control of when it was updated. The problem with the AI models is they're updated underneath your feet. No one's really now creating their own LLM. They're using one of the big players and they're constantly moving. So yeah, it's a risk that you need to control for, and having that regular monitoring is definitely one of the things you can do. And like that's probably the primary thing is you accept that there is a level of uncertainty throughout this, and you need to have a review cycle on top of anything you're doing. There are things you can do, like, you know, for instance, I know Claude, for instance, put out a new model recently. If we were using that in a process, we might temporarily add more oversight for a period of time, so that we can, you know, gauge, well, is this model giving us the same outputs as the previous one was, or outputs of the same quality? And then once you've built that level of confidence in it, you can then pare it back down to what you were doing before. The other thing you can do as well is, and Connor will probably talk to this more, is like automated evals. So like one of the things we do sometimes when we're using AI is we'll constrain the output space. So what I mean by that is we'll tell the LLM to output into specific formats that might be discrete values, like this is low, medium, high. And what you can do is you can run automated evals on these things to say, well, is it adhering to the format I'm expecting? And is any of that, does that data still make sense? So it's nearly like a canary in the coal mine kind of vibe. Those automated checks are doing some of the work to at least show that the output is still the same and there's nothing that's, you know, smells bad within that. And then if there is, you can elevate that kind of output to a human review.
And that we oh, sorry, Connor, go ahead.
I have a little bit to add. Another big point of stuff is choosing the right tasks or workflows and where in the workflow to use. So if you have something that is high risk, if the model underneath changes, it's probably not a job for an LLM. So really understanding your workflow and what you're asking the LLM to do, where you're using the tool, that you're using the appropriate tool for now, and that it's likely to be appropriate for a period of time going forward.
Yeah, I think that's a general point actually that I'd like to make on that, is that, you know, if people are scared about employing AI or deploying AI, pick low risk use cases. So like if you have got, you know, let's say I'm building a QMS procedure for, I don't know, my risk management policy, and I have a trained person who knows what they're doing in that space, but now they want to use a chatbot to help them write that faster. They have the competence. You can do a lightweight tool validation, and you can use it in a way that it's a co-pilot. That document is going to be still under document control in 13485, so it's going to have review and approval. So the way you deploy that AI is actually relatively low risk. So you can actually start using AI in those ways, and then, you know, as you build more confidence, you can increase the level of how much AI you use.
Yeah, that's good. And it ties, I'm just looking at the questions here. So Geraldine's put in a question about, you know, what are some suitable, I think, use cases within a QMS? So things like trend analysis, complaints. And I mean, I guess, you know, what I'm hearing from what you're saying is that well, as anything, it always going to be up to the manufacturer to determine that, but it depends on the risk of the use case. And then, you know, you gave a great example there of that. Like if you're confident that you have appropriate human oversight, competent, well qualified human oversight, then, you know, that is probably a place that you can start inserting. And these are efficiency tools. Like, I think we have to make that point here, is just this, and everything we've talked about in previous webinars, you know, I don't think that, Conor, Curie, correct me if I'm wrong, we've identified anywhere where an AI tool is going to replace a human in a process. These are purely efficiency tools, so that, you know, that the output of the human can perhaps improve, or maybe just reduce the stress because they can manage their existing workload a little bit better. So I guess, you know, like maybe it's more helpful to think of, are there any absolute red flag areas within a QMS where you would not deploy AI? I mean, you mentioned earlier, Stephen, like determining reportability when it comes to adverse events. So like, I don't think anyone can say you can't deploy AI somewhere, but that's a super high risk area. So
can I just go back to the question, which was whereby she's looking at it as these are workflows that need to be done, like trend analysis, QMS. Maybe I'm a bit off there. I think Stephen was using the lingo right there in terms of employ the tool rather than use the tool to do something. I like to think of what LLMs are good at in terms of the specific task or helping within a task. And it's good at extracting data. It's good at drafting things. Stephen gave a couple of examples. It's excellent at drafting things. It's good at auditing to some degree within scope, like, is there a mismatch between these two documents? Did I miss anything here? And it's getting a lot better at that. And then it's good at retrieving stuff. Find the service level agreement I have for this customer in my SharePoint folder. So using that as a concept, like, it'll take things out of a document. It'll help me draft up a document. It'll have a check to see is everything supposed to be in a document, which is a lot of what Stephen's been showing us there, or it'll find something within my SharePoint or my database that I'm looking for. If we think about that and make sure that we're first, as Stephen said, applying those sort of tasks, we're employing those sort of tasks in low risk areas, we can build from there with confidence. We got to stop thinking about it'll do my complaint handling. It will never do your complaint handling, and like even something like it'll do my trend analysis is much too big. There's too much in that. There's probably 20 different tasks in there. Half of them would be useful and half of them don't let AI anywhere near it, if you know what I mean. Is that helpful, or is that still too abstract?
No, I think that's on the money, and I think that's where you should start is looking at, well, like in the majority of cases, people are going to use AI is they're trying to replace a particular part or make it a particular part of their workflow more efficient. So if you can look at what your workflow is, and in the terms that you're using there, it's like, well, what am I doing here? Am I retrieving information? Am I summarizing information? Am I drafting information? Where is the LLM powerful in that workflow? And then building that together. And I think one of the other things is quite important is look at the time sensitivity of it. So like I made the example of incident reporting. If you had a human that was reviewing that, then they reviews that every month, it's not going to go down well in an audit because you need to react to an incident report much faster than that. Whereas if you're doing, like we use AI internally for an example of monitoring for regulatory updates. So like if there's any new standards that are coming out or updates to standards that we need to then deploy within our assessments, we can use AI to pull that information, retrieve it from all different sources, try and do a first pass determination of whether this is applicable to us as a software as a medical device notified body, or if it's not applicable. And then we can have a human like on the loop reviewing that sort of assessment after the fact. If I miss it and I pick it up, or if the AI misses it and I pick it up next week, it's not a problem. So again, that time sensitive nature is like, that's, I think when you talk about human oversight as well, it's like how quickly they need to react. And back to your earlier point, Connor, if it's really time sensitive, that the human has to be there reviewing every output from the AI, well, the human might as well do it anyway.
Yeah, very good. We got an interesting question from SETI here. So that many open source LLMs, Claude, Gemini, ChatGPT, they're not trained specifically for regulatory work. So how do we address automation bias when manufacturers use these tools without the right training? I suspect there's part of the answer in there, and tend to over rely on it, especially for a new startup company with limited RA. So that's a fantastic question. I'm sure that's very, very relevant. I don't, Stephen, do you want to have a crack first and might ask Connor then? Overcoming the bias.
If I take it from, the kind of documentation we'd expect to see within your QMS for this, first of all is okay, transparency on you're using this open source LLM, you do your supplier management and you do your review of the tool. Part of the review of your tool is that you identify that it's not specifically trained in regulatory work, and that is a risk. And then, automation bias within that is obviously a risk. So to be able to mitigate that risk, you're going to need to put competency and training procedures in there to make sure that your people who are using this tool know about these automation biases, know the fact that they can't just accept what's coming out of it, and that they have to, learn to overcome that. And I think the second point on new startups with limited RA expertise, that is one of the issues we see, is a lot of people, for money reasons and that kind of thing, early on in the journey, they want to try and avoid making ORA hires or using external consultants that might cost a lot, and just use LLMs instead. You might get a little bit further faster, but that's going to come home to roost at some point, and it'll catch up with you.
Great promotion for consultants. Thanks, Stephen.
Well, I'll double down on what Stephen's saying there. So we need to think of AI fundamentally as an amplification of what we already have. So if a highly trained consultant or expert or whatever has their hands on one of these tools, they can amplify what they can do. If you've got an idiot like me with an LLM trying to do a quality or regulatory job, I will amplify all right, but what I'll amplify will not be the greatest. You've got to remember as well that you're talking in there, say, about it's not trained for or configured or bias proof against regulatory work. All quality output from any LLM is a matter of controlling the context in order to get the output that you want. And there are lots of tools to do that, from knowledge graphs, fine-tuning engines, RAG. But the most basic one is prompt engineering, knowing what questions to ask in order to narrow and control that context. And that's what you need, training to understand what is appropriate for the task you're trying to do.
Yeah, and I think we've just got another question, so thank you. And I think it's maybe Priya. Apologies if I said your name wrong. Thank you for that question. Nick has put one in. Would using standardized language within the business limit drift in the model, or assist an LLM in generating higher quality content? So kind of that's what you're saying there, is the prompt engineering, prompt libraries, that this is, yeah. And I guess, I would hope that at some point we get to a stage where, Team NB can release a document, or maybe whether we get to an ISO standard or not, but that there would be some common understanding of how AI can be deployed within a regulated environment, and that these are the tools that can help control it, the likes of prompt libraries and stuff like that. I'm
just conscious that we're using the word model drift probably to talk about 20 different things there. Like there's model. Okay, you don't want me to get into that now. Just look up, if you're interested, look up what model drift means on the macro, micro, and everything like that, because it means a lot of different things.
Yeah. Okay, very good. Conscious of time, Kira, are you about to give us the warning?
Yeah, we just missed one of the questions there, so I think it should be an easy one. Priya was just wondering if, as a notified body, does Scarlet use AI to review technical documentation, kind of like what the FDA does on the first screen?
Yeah, the way we're looking at the moment, like the workspace I showed you there is very much our customer portal. And we've got, when you submit that, we've got our assessors portal on the far side. So we've been building out over the last year or two now the additional software functionality within that to help the assessors administration. So how do they retrieve the right information? How do they correlate information? How do they, tag evidence they've seen against MDR requirements that they need to evaluate against? How do they draft findings? So yeah, these are all sort of software features that we build into our platform, and we then have our own QMS that we define how these are used. Yeah, more and more, we're starting to pilot, I would say, the use of LLMs in some of those areas, to just really help the efficiency of the assessor. So again, like what we do is we'll pilot these, see if they work, then we'll be upfront with our competent authority and what we're doing. So yeah, it's always the assessor in control, but more and more we are trying to just leverage as much different technologies as we can to help their assessment journey much more effective, so that we can get a full review and findings back to our customers faster than other notified bodies can.
Just before we wrap up, so you mentioned competent authorities there, and I just wanted to ask, like, from a Scarlet perspective, like, and you've been incredibly open about the way you're using it and the tools you have, so it's really, really appreciated. Like, you guys are the most niche notified body that exists right now, I would say. It's pretty safe to say. Like, are you looking at expanding your scope in terms of different designation codes, being able to handle different kinds of devices other than, you know, your pure software designation that you have right now?
Yeah, so we've recently expanded scope in terms of the region, so we can do FDA third party, and we can also support MDSAP. The thing that we're doing next is looking to be able to expand into more of the hardware devices as well. So, you know, what we're trying to do is meet our customers where their needs are. So we have a lot of customers who are, or prospects who've got software in medical devices, AI in hardware medical devices, but they've also got software as a medical device or AI as a medical device. So at the moment, we're only able to support some of them, but our goal is to be able to support all of them. So yeah, our rough timelines, we're hoping by end of year that we'll be able to have some positive news on that front.
Okay, very good.
Great. Yeah, I know we're slightly over time. I think we could stay here all till
Oh, for
5
sure.
o'clock chatting with all the questions. But really grateful for yourself, Stephen, coming on the call today. I think it added a lot of value. And just to kind of wrap up on the key takeaways, I think definitely from the conversation, it's obvious that AI can be used today and in multiple ways, but finding the right place and starting with the low risk tasks is really important. Governance matters more than validation. I think validation is a difficult word in this industry, but it's just not a term that can't be used when we're discussing AI. And the goal is reasonable adoption. And I think training is a key takeaway that you can take out of this conversation. We all need to learn how to communicate with LLMs. So with that, thanks everyone again for attending today's session. And if you have any more questions, feel free to reach out. But thanks very much.
Can I just say a big thank you to Stephen for coming along, and also a huge thank you to Kira, who has herded cats for the last year in putting all of this together and is now leaving us for sunnier climes next week. So she won't be here on our last webinar of the series, but she put all this together, and just a huge thanks to her for all the hard work she's put in.
Yeah, so you've seen the high point. It's all downhill.
It's all downhill from here.
Yeah.
I'll log in as an attendee to judge how you're doing. Thanks very much.
Excellent. Thanks,
How do people
everyone.
contact you? Can contact Stephen there anyway. You can see the email address, and this will be circulated afterwards.
Yeah, definitely.